Mi365 Podcasts with me, Pete Cohen. Hi, it's Pete Cohen here, and you join me for another Mi365 podcast. And today we have the amazing Dr. Chris Pickard. How are you, my friend?
I am very well and very happy to be joining you this bright, sunny morning here in Finchley.
Absolutely. Finchley is the centre of the world, for those of you that don't know Finchley. Today we're going to talk about a condition that is affecting a lot of people all over the world. It's a condition that's known as fibromyalgia. Tell us a little bit about that. Tell us, actually, Chris, tell us first and foremost, what do you do for a living?
Okay, well, I originally started off as a chiropractor, and I'm a doctor of chiropractic. I then studied a lot of nutrition, and now I don't actually practice chiropractic or nutrition as they traditionally work. I actually practice everything together holistically to try and find out what's wrong with the individual that comes to me so that I can give them what they need to go ahead and get better.
Yeah, and I'm actually aware of many of the procedures that you use. I've met many of your patients. I've actually seen you myself, and I think you're one of the best practitioners I've ever come across. So let's talk about fibromyalgia, because it seems to be so popular and prevalent in the world today. Tell us what the condition actually is, first and foremost.
Well, it's typified by three main symptoms. Lots of body-wide pain that doesn't seem to go away, fatigue and brain fog. There are about 200 different symptoms altogether that is linked for fibromyalgia, but those are the top three. And I've been looking after people with fibromyalgia for about 20 years now.
So why is this such an area of interest to you? Because you've said to me recently this is an area that you're really you're on a crusade to help people with this condition.
Yes, it's mainly because, well, I'll start at the beginning because it's easier this way. 20 years ago, when I first started, when I was a chiropractor, I saw my first patient with fibromyalgia. And as a chiropractor, I was able to get people out of physical pain, usually pretty quickly. 6, 7, 8, 9 treatments, and people with back pain or sports injuries would get better. With fibromyalgia, though, what would happen is I'd be able to help people with temporary relief, and then it would come back. And it was only ever temporary relief. It was when I started getting into the field of nutrition that things seemed to start getting a little bit better, and people would have a little bit more of a long-term relief. But over the years, it became increasingly clear that fibromyalgia was incredibly complex, and there is more than just one theory as to why people have it, is what the cause is, and some people would respond amazingly well, and some people would hardly respond at all, and they'd be in every week just to get some relief because nothing else was working. Mm-hmm. Even what I could do would only work for a few days.
So that must be quite frustrating for you when you're trying to help people and you realise they're not getting better, because you're kind of like a little bit like, I wouldn't say a nutty professor, but you're obsessed with optimal health, and you're always tinkering and looking to play around with things. So that must be quite challenging when someone's coming in and they're not getting better and they're in so much pain, right? Because pain is often the body's way of telling you that something's not right. Is that?
Yes. Yeah, ultimately, pain signal to the brain is there's a problem somewhere, please fix me.
Yeah.
And something like fibromyalgia, certainly when then people aren't getting better, it is so frustrating, because the thing that gives me more satisfaction than anything else is when people get better and they come in and say, my life has changed, I can do this, I can exercise, I can pick up my grandkids, I can play with my kids, I can cook, I can go to work again. Those things, they make my day more than anything else.
So let's kind of reverse engineer this. Let's talk about the success that you've had with people that have had this condition. Then let's talk about the treatment that you've given them. And then let's talk about why people get the condition in the first place, if that's okay. I know that's kind of a different way of doing it, but so what sort of success have you had with some people with this condition?
Well, over the past 20 years, off and on, but over the past year, 18 months, 2 years, I've had great success because I've managed to combine a number of different things together, and I've managed to investigate what's going on in the scientific press, all the new studies that have come out, and so it's actually explained why I'm having the success I now am.
That's amazing. So tell me about any of those success stories. Have you had some people that things have really transformed for them?
Well, yeah, just recently I had a young girl. She had been diagnosed with fibromyalgia, and she had all kinds of symptoms. She has the brain fog, the pain, the fatigue, irritable bowel syndrome, everything going. She's having all kinds of investigations on all kinds of medication, headaches all the time, neck pain all the time. And we've worked on her. We've had about 4 or 5 sessions, and already a lot of her pain is subsiding. We've only got her on one basic nutrient, and that's already changing her energy levels as well. So she's able to get up, function. She's stopped craving horrible foods that are bad for her, and she's bright and sparky and very happy.
Wow.
That's in about 2 months. That's a very quick change.
But you've got other cases as well of people who have had some real significant changes.
Yes.
So do you believe this is a condition that people can overcome? And
I believe that about 25% of people who've been diagnosed with fibromyalgia haven't actually got fibromyalgia. So at least a quarter of people can, I think, get completely better very quickly. The other 75%, I believe, judging from my own results, that most of them can get a lot better. They can certainly get off all of their medication, and they can function normally, and with a bit of care they don't have to worry. They don't have any real problems.
So we'll look at the science.
Mm-hmm.
We'll look at the science in a minute. So someone we both know very well, Dr. Rakowski, one of the top nutritionists in the world. I remember him saying to me and my wife, how does a whirlwind start? How does a tornado start? They start because the conditions are right. How does cancer start? It start because the conditions are right. Is that the same with fibromyalgia, that it starts because the conditions are right?
Almost certainly. Yeah, well, it has to be that way.
Yeah, I know. It kind of sounds like a really odd question to ask. It's like, well, is it the fact that someone's unlucky, but still, even if they were unlucky, it still has to be certain conditions. So what are those conditions that create this condition?
Well, the conditions, it really does seem to be like so many other problems, come down to a myriad of different things happening at the same time. But my belief is all down to toxicity and the inability of the body to get rid of toxins. And it's the individual's genetic makeup that then predisposes as to what condition they get. Whereas some people it's going to be cancer, in some people it's going to be heart disease, in some people it's going to be fibromyalgia.
I really want to delve into that whole toxin thing, because I think it's just people just don't talk about it. But we do live in when people say we live in a toxic world, it sounds like Neil from the Young Ones.
Yes.
What does that actually mean? We live in a toxic world compared to the world that we lived in 40, 50, 60, 100 years ago.
Well, actually, even 40, 50, 60 years ago, there are still toxins in the environment. It's just that there are now even more man-made ones.
Like what?
Well, PCBs.
So what, plastics?
Yeah, plastics. But there's also a huge amount of it is the pesticides.
Yeah.
That they're there to stop pests killing our food supply, but they themselves then get into our systems and cause problems. Now, there are a lot of skeptics that say, these toxins, they're not in us, it's all a bit bogus. But in America, they have been, every time someone has surgery, they take a fat sample from that person and they take it to some lab somewhere in America and they assay it to see what toxins are in there. And there are 5 of the world's most deadly toxins that I think have been found in every single sample that has been looked at in the USA in every single surgery. And there's now a lot of science that says that every single one of us has at least 700 man-made toxins inside of us. Almost 200 of which are known cancer causes, and others they all shut down something in your body called mitochondria, which are your body's energy production powerhouses.
Yeah, it's fascinating. I mean, I live in London, but I was in Denmark a few months ago just for a day, but the air was so clean. Everything was so different. When you live in London and you come and blow your nose at the end of the day, you can just often see that black stuff has come out of your nose, and it's like, well, that's because of what's in the air. So how does what is in the air affect our bodies? You say it affects energy production, right?
Energy production and the ability of each cell to live, yes.
Okay. So in terms of fibromyalgia, tell me let's look at the way that you would treat this. So you were telling me about a study recently, a 6-week study that was done with the Chinese mushroom reishi, also known as Ganoderma lucidum lingzi. Tell me about that study.
Yes, and that was a study on, I think it was 64 women with fibromyalgia, and they were given 6 grams a day of Ganoderma lucidum. And at the end of that 6 weeks, they all improved in physical fitness, which is that's a key element to any kind of recovery program in fibromyalgia. Exercise and getting people to exercise is the key. Well, as I said, there are hundreds of different theories and about why fibromyalgia exists, and there are lots of studies into different ways of getting them better. But the overall prevailing science says that exercise and a graded exercise program is the key to improving people with fibromyalgia. Getting them moving. When you get moving, it helps you produce energy, and it actually helps decrease inflammation. The problem with fibromyalgia, though, is even a little bit of exercise seems to cause a lot of pain and then more fatigue, and then you pay for it. So you've got to do it very, very gradually. What reishi mushroom seems to do is it seems to kind of kickstart that whole process and make you able to do more exercise more easily. So it means you can then exercise and get better quicker.
So tell me what else Ganoderma reishi does, because obviously it's been around for thousands of years. Tell me a little bit more about that.
Well, it contains, I think it's somewhere in excess of about 200 to 400 different chemical compounds that seem to have all kinds of different effects on the human body. Everything from boosting something called nitric oxide, which is important for exercise and brain health. It seems to help your liver and your kidneys clean your body. It seems to be very good for the skin. It's very good for the brain. The list just seems to keep on going on and on.
So with the Ganoderma, because I know it's been in Chinese. I met some people from Hong Kong recently, and they told me that it means they didn't know each other, these two people, but they both said it also means bring back from the dead. You know, that this has been in Chinese medicine for thousands of years, that if you were caught with it and you were not in the royal family, they would literally chop your arm off. First offence, second offence, they'd kill you. But what I find so fascinating is, how did they know? They didn't have all of the science that we have today to do randomized clinical trials on things. They just obviously knew. Why do you think that information is so lost?
Well,
because it's lost in China. It's not lost there. It just seems to be in the West that we're very, closed to using natural remedies to treat the body.
Well, it's because of the way that science progressed. Science is amazing at trying to reveal the truth behind things. But the way that science works, it's very reductionist. It looks at things in smaller and smaller parts and tries to find out, well, okay, so we've got this amazing mushroom that has all these effects. Why does it do it? And so it takes things apart smaller and smaller and smaller and looks more at trying to find what is the active component that's doing this or doing that. And it's a bit like looking at, if you've got a radio, an old style radio before digital radios, or even digital radios, and you've got a voice coming out of it, and you try and find out where the voice is coming from. It's not coming from any one particular component, it's coming in how everything is working together. And whereas science is really good at looking at all the individual components, it can sometimes miss the whole.
Yeah.
And that is unfortunately where Western medicine is at fault, is it looks too much at the parts and not at the whole.
Well, also because, we're again looking at fibromyalgia and looking at different treatments, but using this Ganoderma as an example, because there's many studies, right? There's probably a couple of thousand studies on PubMed, but there's actually quite a few significant ones that actually show, hey, this really does do something.
Yeah.
But the problem with Western medicine is that they can't use broccoli. They've got to take an element of something and I think what they found with reishi was every time they took an element of it, a bit of it, it didn't work as well. It's like the intelligence or the healing benefits from it come from the whole thing, not from a part. Is that correct?
Yes. Yeah, and again, when we get into some of the stuff about fibromyalgia later, it becomes clear how important it is to look at the overall effect of something as a whole rather than just one particular effect of it. Because everything, for instance, aspirin. Aspirin by itself has many positive uses, but it also can punch holes in your gut lining and cause you to bleed to death.
Yeah.
In nature, aspirin comes with other things in barks and in herbs that actually prevent those bad side effects from happening. So even though the aspirin part of it is good for getting rid of the headache, that same part is very bad for you in other areas.
Yeah.
Whereas in nature, it comes with all the compounds to only give you the good parts.
So what other things have you noticed with people that are taking Ganoderma lucidum? I mean, what else does that actually do? Because the Chinese call it the king of herbs, right? So what else does that do to the human body that might help someone with fibromyalgia?
Well, after seeing this study about Ganoderma on fibromyalgia, I was trying to figure out why is Ganoderma having such a good effect. And as I mentioned before, it seems to have an effect on something called nitric oxide. So I looked at nitric oxide studies in fibromyalgia.
What is nitric oxide?
Nitric oxide is a very important chemical in your body that helps with circulation, helps get more oxygen into your muscles. So therefore, that sounds like a great way of starting for people with fibromyalgia. It also helps bring down inflammation. It's very, very important for your heart, and it's also much needed for the brain and parts of your immune system as well. Again, something that most fibromyalgia patients would think, yeah, it's got to be the nitric oxide. But there doesn't seem to be many studies on nitric oxide and fibromyalgia as yet.
Yeah.
The very latest studies on fibromyalgia have shown that people with fibromyalgia have a problem with a particular molecule known as adenosine monophosphate, just shortened to AMP. Now, what usually happens in most people when they exercise, AMP gets activated by an enzyme called kinase, so it gets called AMPK. And what's happening in people with fibromyalgia is AMP does not get turned into AMPK. And this is a problem because AMPK then allows you to utilize all of your energy stores.
Yeah.
And so when you exercise, AMPK is made and you can make energy. What's happening in fibromyalgia? That isn't happening. Now, in your muscles, this can cause muscle pain and fatigue because AMPK is also part of bringing down inflammation. It's also vital for proper functioning of the brain as well. And there are studies that show that reishi mushroom actually has an effect on turning AMP to AMPK. And AMPK is needed in every single cell in your body to make it work properly. So reishi is actually having a beneficial effect on every single cell in your body, my belief, through activating AMP to AMPK.
Okay, and what else does it do? You said it's nitrate down. It also isn't reishi an anti-inflammatory as well?
Yeah, an anti-inflammatory through various different means. One of them, I'm sure, is through its activation of AMP to AMPK.
Okay. So what else could someone do? How else do you what other remedies are there out there that someone might find would give them relief or help them?
With fibromyalgia specifically? Well, the ones that seem to be the most commonly used in clinics are things like magnesium and malic acid. They seem to help with energy production in the body. Again, I've been using magnesium and malic acid and malate for a long, long time, and some people with fibromyalgia do find it helpful, but there doesn't seem to be anywhere near the percentage as with reishi mushroom.
So, but what about with all of these supplements and where you're getting them from? Buying them from Holland and Barrett as opposed to, because a lot of these products are grown really like in bags and not in nature.
Yes, there is a big difference in quality between different companies as well. So for instance, going back to just the Ganoderma study, they had to take 6 grams a day to have this effect over 6 weeks, whereas the particular brand that we use in the clinic, my patients take on average probably between 1 and 2 grams a day. So they're needing much less to get the same effect.
But are you getting them to take, because with the mushroom there are 3 components, right? There's the mycelium, which is the bit under the ground.
Yes.
Then there's the mushroom itself, and then when the mushroom germinates, which is the spores, right? So
yes.
What do you get them to take?
On fibromyalgia, it's the spores. The spores seem to have the best overall effect on bringing down inflammation and improving athletic ability, which is why I use it.
So how much more powerful is the spores then?
Considerably more. Yeah, considerably more. I mean, some people get some aspects of the of the Ganoderma are 17 to 75 times more prevalent in the spores than the rest.
Yeah.
Which is why I think people with fibromyalgia have such a great effect on the spores as opposed to the normal Ganoderma, and why they need so much less.
So if someone has fibromyalgia and they want to reach out to you, what's the best way for them to do that? Can you see people virtually?
Yes, I can do consults over the phone. I can do consults via email, via Skype. They don't have to come and see me. You can just go to my website, the Pain Relief Centres, spelled the English way, .co.uk, and just fill in the chat box with my virtual assistant Jill that comes up. Just fill in the chat box, tell them, say you've got fibromyalgia, and I'll get back to you.
So, Chris, finally, just tell us, for all the people with fibromyalgia, and I know we could talk about this subject for a long time, but for the people out there listening to this who maybe have the condition or they know people that have, what would you say to them?
Well, it's very important to get to exercise. That's the most important thing, and finding something easy that gives you that ability to start exercising is key. But what you also have to do is get to the actual underlying causes of fibromyalgia. It's like there doesn't seem to be a genetic reason why in fibromyalgia patients why AMP isn't turning into AMPK. It seems to be due to toxins. So once you started exercising, it's important to then actually detox, which I think we're going to cover at another stage.
Yeah.
It's very, very important to detox. And also, we think we're seeming to discover why more women have it than men, considerably more women, and it's to do with estrogen. Now, just going back a little bit to what we said earlier about how science reduces things, estrogen itself has been shown to help AMP turn into AMPK. So surely estrogen would be better, and therefore more men should have fibromyalgia than women. But that's when you just look at one part of estrogen. Other parts of estrogen, we know that it's a big load on the liver, and it means that the liver then gets clogged up, and also estrogen becomes toxic to cells and actually causes the mitochondria to fail. So even though it helps one part, it's detrimental to other parts. And that seems to be the biggest difference, is there's estrogen, and there are now so many toxic estrogens in the world that's why more men are getting fibromyalgia now, why more women are getting fibromyalgia, why it's getting worse and worse and worse because of toxic estrogens.
But this is something you can help people with quite clearly and help them go through the process to better health.
Yes, thank you to what I learned from Dr. Bob Brukowski, who you interviewed recently.
Yeah, so there's a podcast that people can listen to, the Magnificent Seven, but I'm sure a lot of our listeners will be listening, finding out more from you, Chris. So tell us again where they can find out more about you, the website.
Okay, the website is...
The all-important website.
The all-important is the Pain Relief Centres, plural.co.uk, and just fill in the chat box that comes up with your name and email and phone number, and we'll get back to you as soon as possible. And I'm happy to give away free consults as well at the moment until I get so busy that I can't do any more.
Brilliant. Thank you so much. Very informative.
Thank you very much.
I hope you enjoyed this podcast, and if you want more free inspiration to optimize your life so you can achieve your goals in all the different areas of your life, then visit Mi365.me. That's Mi365.me, and sign up to 365 days of free coaching with me, Pete Cohen. Thanks for listening, and have an awesome day.